much, John. First time I heard John speak, his lectures were an hour and a half of biochemistry, and I remember turning to a father who was taking copious notes next to me, and I said, "Are you understanding all this?" And he said, "Yeah." He said, "What about you?" No. So, after a while, you will get used to it, I know. There's a lot of new folks out there, and you're hearing things for the first time. What I hope to do today is explain things in a way that you can go home and start today, start tomorrow on making some changes in the life of your child without the help of a physician initially, because it's going to be a while. But these are things you can do. I want you all to be able to get a physician to work with. But these are some things that I want you to be able to do today that you can do very safely, applying things that you've heard today and over the rest of this weekend. I know that autism is a global problem. I've already met people here today from Hong Kong, from Australia, from all over the United States. We see people in our clinic from everywhere. It doesn't seem to matter what kind of environment they grow in. The children are coming to us and they're very broken. In fact, I was written up in this Japanese magazine. I think it was good, but we won't dwell on that. This is my very first patient with autism. I am a pediatrician, and I remember in the 80s when I was having my formal training, they said, "Oh, look, Dr. Kartzinel, here's an autistic kid. You'll never see one again." And I saw one, really, in the 3 years of my pediatric training. As you can see, at age 1, he's standing, making good eye contact, even that infamous pointing. 3 months after he received his MMR, you can see he turned into this just crumpled little boy. You see the medicinal wine in the front. That was for my wife to handle the issues. She said, "You broke him, now you fix him." And that sent me on this journey. So here he is now, and he's my ongoing inspiration. So let's get to work here. Let's talk a little bit about, thank you, about nutrition. This obviously is not a specific carbohydrate diet. He is eating corn. As a clinician, I'm looking at patterns. I'm looking for patterns of abnormalities that I can treat. You see, I don't treat autism. I treat the problems that go along with it. Okay, so things that I can sink my teeth into. So looking at the GI tract, I'm looking at issues that we've already spoke about, problems with digestion, alterations in bowel flora, increased gut wall permeability, disease of lymphoids, which is like the tonsils in the gut, and inflammation in the bowels, inflammatory bowel disease. These patterns in the immune system come to us as far as decreased resistance to infections. I'll have children who present with 40 or 50 different occurrences of antibiotic usage for ear infections or sinus infections, and nobody's ever evaluated the immune system for why they're getting all of these infections. They have autoimmune issues. They shift away from T helper cell 1 functions to T helper cell 2 functions. Again, immune system regulation is a problem. And lots of food sensitivities and allergies to the world. More patterns in the central nervous system. We see altered sensitivities, abnormal processing of sensory and expressive information, abnormal transmitter functions. They're just not working properly. Biochemical peculiarities that we come across are nutritional deficits that we've just spoken about, increased sensitivities to toxins, problems creating DNA building blocks, abnormal levels of sulfur and amino acids, and impaired abilities to detoxify themselves. So our options: nutritional approach. We need to fix the digestive problems first. Dietary changes, those gluten-free, casein-free, allergy-free, specific carbohydrate diets, and on they go. Adding vitamins, minerals, fatty acids, probiotics, digestive enzymes, supporting the immune system, and things that might help our cognition to be able to be more aware of what's going on in our world. Remember, I look at autism as a mismanagement of incoming information, and that's why you hear this thing called a spectrum. On one side of the spectrum, you have a child who's rocking, he's biting his hand, he doesn't know mom or dad or light or dark. He's really totally unaware. And on the other hand of the spectrum, you might have a child with ADD, attention deficit disorder. He's getting everything more normally, but when that teacher is talking about George Washington being the first president of the United States, married a wonderful lady, was involved with the war and all that, the kid doesn't get it. He doesn't get it. Now, what do these two children have in common? Mismanagement of incoming information. This one, everything. And this one, just things maybe that have to do with the classroom. He speaks well and plays on the soccer field. And our kids are somewhere in between there. So what we're trying to do is move our kids more off the spectrum, improve their abilities to understand what's going on. We have to start with someplace, and that's the metabolic systems. When we look at laboratory testing options, there's myriads of options, and everybody's got tests. We do have to take a look at what's going on in these kids from a metabolic, looking at the wet stuff, as we heard earlier today. And all of the issues that we find have to be addressed, but eventually we can't do it all. We prioritize what's going on, and we generally use the gut as the first place that we start. There are some basic laboratory evaluations that all of our kids need, and then specifically what might apply to your particular child. I tend to look at red blood cell elements to see get a feel for where my minerals are. Are we low in zinc? Are we low in selenium? Are we low in calcium? Things that I can take a look at and use as a measuring tool to see how I'm doing 3-6 months down the road with my replenishment of these minerals. Because sometimes the mineral that I want to give your child is not one that's going to be absorbed. But I'm on 80 milligrams of zinc a day, Doc. How come my zinc is still in the bottom of the barrel there? Well, I have to think about maybe we're using the wrong zinc. But it comes from this laboratory. They promised me it's pure. Well, that might work well in one child, but in your child it may not work well in. I get a fatty acid profile to help guide me where I need to go with replenishment of those fatty acids that we just heard about. A complete blood count to see if we're anemic, to see if we're having problems with white blood cells, pointing toward the immune system, allergies, and we can learn a lot from just some simple tests that your health insurance will usually cover. Looking at reduced glutathione, which you're going to hear a lot about over this weekend, immunoglobulin profile, thyroid studies, and detoxification genomics, if I want to get fancy. Then looking at antibody titers, how, is there a problem with the vaccines? Is there a problem with viruses? Food allergy profiles, learning what specifically your child may not be able to do well with, like my son can't do well with white potatoes. Looking specifically at the gastrointestinal tract, urine organic acid test, stool diagnostic studies, food allergy profile, because the food goes into the digestive tract and can irritate it, abdominal x-rays, considering if the child has got this big problem with constipation. The urine organic acid test will let us know what kind of biological markers might indicate overgrowth of yeast or bad bacteria. Stool studies, like you've already seen, can show us. In this particular one I picked because lactobacillus, the beneficial E. coli, not the bad stuff you hear about, bifidobacterium, they're all 4+, and yet in this child we still have problems with something called Pseudomonas and Candida. So even if you're doing everything right with probiotics, if that immune system isn't detecting these germs as foes, as pathogens, it might allow them to live, even in the presence of good, healthy bacteria. And then, of course, I see a lot of parasites, and that tends to be understated in the pediatric population because everybody knows our kids don't have parasites, but I get them. They even take pictures of them. They're not making it up. And, of course, the kids can be very constipated. It's hard to tell from this picture, but this child is really, really full of stool. The stool just doesn't move. How many families here have children who are constipated all the time, have real struggles? And how many with diarrhea? And how many with both? And the pediatricians, our family doctors, don't seem to have a problem with that. They allow them to have that. Well, anyway, individual elements from our history, our physical examination, and our laboratories come together and allows me to then set up a plan for each child. The issues, like I said, all of them have to be addressed eventually. The priority is unique to each child. However, the gut is generally the best place to start. Well, actually, sleep is the best place to start. But usually fixing the gut can remedy many of the sleep issues because the kids wake up, they're hurting, they're cramping, they're refluxing, something is going on with the bowels. I had one family who the child hadn't slept for 4 years, up all night, go to sleep for 20 minutes, an hour, wake up. Dad comes in, a well-to-do gentleman, says, if you get my kid to sleep all night, I'll buy you a brand new Porsche Boxster. You pick the color. I'm going, yeah, I can do this. Got the kid to sleep the whole night, but I'm still waiting for my Porsche Boxster. Obviously, he forgot about his little promise there. Our issues with the gut, inflammatory bowel disease, when we look at inside what's going on with these kids, they look just terrible. They've got these little red ulcers and all kinds of problems with the bowels. They're hurting children. There's problems with opiates, and that's why we're talking about getting rid of gluten and casein. Dysmotility, they're just not moving stool in the proper fashion, either too slowly and they're constipated or too quickly and they're having diarrhea. Leaky gut, they're absorbing things into the bloodstream that just shouldn't be there. bad bugs growing. What kind of issues do we see with the stools? Well, pain, bloatiness, gassiness, soiling, constipation, diarrhea, or both. Little interest in eating, nighttime awakening, and lots of reflux, foul-smelling stools, and foul breath too. And again, I believe this is in your book, but this is how I look at specifically the sick gut. Well, let's talk about diarrhea. Well, this is the best cartoon I can get without grossing everybody out. Children with diarrhea can have anywhere from 1 to 6 stools a day, maybe more, and they can be described to me in the most wonderful ways, like soft serve ice cream, brown rice water. They could be green, it could be yellow, it could be orange. It could be incredibly foul smelling. But the children are letting us know that they're having problems with digestion, obviously. Absorption, things just aren't happening well inside. When I think about what I can use to help treat diarrhea, obviously removing gluten and dairy and corn and soy, specific carbohydrate diet, digestive enzymes are very important. If they have fungal issues, treating the fungal issues. If they've got bad bugs growing in their bowels, then we have to treat them with antibiotics. We have to basically add fiber and zinc, natural anti-inflammatory agents. Sometimes I have to use ibuprofen. I mean, these children are hurting. But what's broken can be fixed. I get all kinds of pictures. You see some Christmas cards. But 2 things here. We've gone from a pile of mush to form squiggly stool, which we're getting there, but it's in the toilet too. Meaning when they feel better, when they perceive things better, then things like going potty and poop on a toilet makes sense to them. Remember, mismanagement of incoming information. My German Shepherd knows where to go poop and pee. How come my kid doesn't know where to go poop and pee? He's a lot smarter than the German Shepherd. Mismanagement of incoming information. Don't you think that what you feel when your bladder is full is what our kids feel when their bladder is full? Okay, they have this mismanagement of incoming information. When we do things right, then all of a sudden, oh, full bladder means I got to go pee. I can go use the pot for that. My son will start wetting the bed and wetting during the day if he gets yeasty. Like just the lamp cord comes out of the wall. His bladder just totally disconnects from the body. Constipation. This is not protein malnutrition. This is tummies that are really distended because of poop. And the pediatrician told this family, let's wait till he's 3 to work on this. He's a little too young. This child is going to be crabby. Can you imagine teaching this child, being his therapist, working with the ABA? Regardless of what we think about autism, if you have a child who you're trying to teach and they're in pain versus a child who you're trying to teach who is comfortable with the skin that he's in, you're going to get a whole lot more bang for your buck there when you're trying to get these kids going. But you can see that we can make nice progress with that. Here's a little girl. And then 6 months later, notice 6 months later. It doesn't happen overnight to get the bowels trained. Constipation in my book is huge hard stools, small pebbles compressed together, infrequent stooling every 1 to 2 days, but it could go every 4 or 5 days, every 6 days. They could be foul smelling, they can look like little pellets. You can have some foul breath and body odor too when this happens. And of course you see some behavioral changes. These kids, parents will tell you he's at his absolute worst behavior right before he has a bowel movement, and for an hour or 2 after a big bowel movement, he's a pretty neat kid. Yeah? She's doing pretty good. Treatments. Enemas, glycerin suppositories, especially on the younger kids. The older kids, it's not quite so easy. Essential fatty acids. I've used things like Fruities, George's Aloe, magnesium citrate. Occasionally, once in a while, something called Smooth Move tea. That's a senna preparation. You can get addicted to that. Benefiber, vitamin C. I might have to reach into my MD tool chest and bring out some Miralax, milk of magnesia, and then maybe gastrogafin enemas, or maybe we have to actually get them to see the gastroenterologist. This is something we're doing in our office now. It's called wireless capsule endoscopy. It's a pretty big capsule, but our ABA therapists can teach the children how to swallow these capsules, or at the time of endoscopy, they can be placed in the stomach. As you know that we need to see what's going on in the bowels, and the gastroenterologist can actually place a tube down the throat into the stomach, and just outside the stomach, and then he has to stop. And then he can stick a tube up the bottom and take pictures, and kind of goes up the whole colon, but has to stop right around the appendix or just at the very end of the small intestine. This goes all the way through, and for the first time we're able to characterize the disease processes that's going in the small intestine. This little thing has a built-in flash. It takes 4 pictures per second. The new model, the old model, took 2 pictures per second. And it takes about 5 hours to make the transit time, and for the first time we can actually see what's going on the whole digestive tract. And this is what it looks like. I don't know quite, yeah, it looks pretty good on the screen, but you can actually see inflammation in the ileum. The little arrow there is for the redness that you can see. And in here, this was an 11-year-old girl who revealed narrowing and ulceration in the distal small bowel. This child was in pain, didn't want to eat, and we had to figure out why. This will help the gastroenterologist figure out which medications might benefit the child best, knowing where these sores are. Reflux. A lot of our children have reflux. That was another nice slide. We have some gross ones, but. History of recurrent cough, night awakenings, but listen guys, frequent ear, sinus, and pneumonias, and asthma, small vomits, these are all seen with reflux disease. We consider Prevacid, Nexium, Tagamet, and Pepcid. That's a Band-Aid. The question is, why is the child refluxing? But until we can figure out why the child's refluxing, let's stop that acid from percolating up the esophagus and burning them and causing these complications in the ears and the sinuses. Food allergies can do this as well. We have lots of documented evidence that you remove foods that are bothering them, the reflux goes away. Eczema can go away. So let's get right into supplements. It's good for our plants. It's good for our children. This is their usual diet. My son was only eating Chips Ahoy cookies, bacon, Fruit Loops, French fries, and a gallon of milk each day. Oh, and a Flintstones vitamin, because I am the pediatrician, and he was going to get his vitamin source. Didn't know anything about omega-3s. You know, so if I can do it, you know, it's if you have to say it, one nice thing about having a child with autism is you can't tell me what it's like to have a kid who won't eat. But I had one mom say, yeah, but you don't know what it's like to be a woman and have a kid who won't eat. Yes, you got me there. Well, why do we want to do this anyway? Primary goals of our supplementation is we're trying to get their physiology back. We're trying to get them to work the way God intended. Improve the function of the immune system, enhance the cognitive abilities, improve red cell membrane functions, reduce autistic behaviors, improve gastrointestinal function, minimize the negative genetic influences. Remember, we had that nice lecture this morning about we're born with these genetic influences, but how do we minimize them? You know, people say to me, well, don't you think some of this is genetic, that same story that we heard about? And I said, well, my eyesight is genetic. And they didn't say, well, Dr. Jerry, you're not going to be able to drive or play tennis because you just can't see. They said, well, what can we do to make a patch for it so you can see and perceive things in our world the way other people do? Well, it's called glasses. So whatever the genetics are here that we're dealing with our kids, let's find the prescriptions for these kids so that they can see and perceive our world the same way we do. And that's what it means to minimize this. Nutritional approach. Dietary changes we've covered, allergy removal, specific carbohydrate diet if necessary. You'll hear about these things. I'm just kind of letting you know about them. Vitamins, minerals, fatty acids, probiotics, digestive enzymes. And with calcium, what do? We typically take them off of all dairy-containing foods, and that's a major source of calcium, and our kids aren't really eating broccoli yet, so we actually have to supplement them with calcium, and we use calcium citrate, glycinate, malate. Again, the bottom line is I use a lot of common sense from Grandma. Grandma says if what you're doing isn't working, don't keep doing it. So if you heard from me that calcium citrate's the best calcium source, and 6 months from now your doctor measures calcium levels in your child and they're still really low, it's the wrong calcium for that particular body. They can't absorb it, so move on to something different. Magnesium is very important to give along with calcium. Zinc deficiency, when I'm speaking to a large group like this, I have to be careful with my recommendations, but all of our kids, whether they're 20 pounds or they're 50 pounds, can tolerate 20 milligrams of zinc a day. Sometimes I have kids on a whole lot more. You'll hear some people saying it's best to give zinc at bedtime, it's best to give zinc in the morning. Just give zinc. If it gets into them, you know, zinc can also make you very nauseous, and you're actually giving them zinc right before bed and then saying goodnight. Some children require much higher doses, and it's good to follow these with blood levels. Zinc baconolate and zinc monomethionine are the ones that I tend to prefer, as I see I get a little better response in getting that zinc bumped up in our kids. Selenium deficiency, many of our kids, when the first time I see them are very selenium deficient, and we'll aim somewhere between 25 and 100 micrograms daily. We follow those with what's called an RBC elements. Chromium deficiency can help stabilize the way the kids crave sugar or stabilize the blood sugars in their body, and I'll start somewhere between 50 to 100 micrograms daily if I see that there's a chromium deficiency in them. Absorption of iron, we already talked about. We have it pretty well worked out. We kind of know how iron is absorbed. In this day and age of HMO medicine, what they'll do very often is get what's just a hematocrit, which is just a little blood test like from the finger, and say, no, the kid's fine, doesn't have any iron deficiency problems. But again, if you take a dietary history and they're only existing on Chips Ahoy cookies, bacon, and Fruit Loops, where's the iron going to come from? Let's take a little bit more of a look at what's going on in their system, and you'll find that you do need to get what's called a CBC, and a reticulocyte count, a serum ferritin, total iron binding capacity, to get an idea where your child's iron stores are and how your child's producing, good healthy red blood cells. Iodine deficiency, there's a big move to get away from Morton iodized salt, and we get into sea salt or no salt. These children do need iodine. And an ASU study showed 50% of autistics were low in iodine. Omega-3 fatty acids we covered. We can measure them. There's studies that have shown that omega-3s are low in our children, and so just about everybody needs omega-3s. In fact, one of the first conferences I went to, I heard Dr. Mary Megson speaking about cod liver oil, and I thought, there's no way you're going to give cod liver oil to my kid. And it was amazing. We gave, not only did he want the cod liver oil, he craved it, and this was the old stuff. This was years and years ago before they came out with Tutti Frutti cod liver oil. This was stuff from GNC, had been sitting on the shelf for 6 years, and it smelled like you think it would, and my son just sucked it down. I'd tell him to go give mommy a kiss. But within 3 or 4 days, eye contact was phenomenal. And so that's when I knew as a pediatrician, there is a chance to make these kids better, because my kid was making no eye contact before I used that. So we recommend using cod liver oil to start with these children, but remember, and it was kind of alluded to, anything that we do with our kids, even though we're trying to push them forward, can have an equal but opposite negative reaction. I've had parents tell me, Dr. Kartzinel, we're scraping little Jim off the ceiling now. Could it be the cod liver oil you started him on? It's all my fault. Anything we do can make these kids a whole lot worse. So you tend to start things one at a time with these children. These are in your handout. And that's a picture of a baby drinking cod liver oil right out of the bottle. Okay. Of course, I'm not recommending that. And that's another child who just had cod liver oil. It can be very difficult getting these children to consume some of the things that we want to give them. So look for transdermal products. Cod liver oil has to be taken orally. It's best, I've heard it. You can rub it, I've been doing this a long time. Oh no, doc, you could just rub it on their skin, and then every cat in the neighborhood just loves these kids. I had one mom, she was very ingenious. This child wouldn't eat anything but French fries, so she went to McDonald's before that we knew they were not gluten, casein free, and she'd ask them to overcook the fries, which hollows them out. She'd break it off, stick the stuff that we want into the fries, stuff the cap back in, and the kid would eat it. So you just have to be very clever on getting our kids to consume some of these things. Failure to thrive. I have a lot of children who look like this, unfortunately. I call failure to thrive the same weight for a long period. Age of the bone is well behind the chronological age. In other words, I have a 5-year-old boy with a 2.5-year-old skeleton. They're thin, they're pale, they're irritable, their height and weight is well below the 5th percentile. Causes of failure to thrive are stress, poor caloric intake, poor digestion, poor absorption, gut motility issues. There are many other issues, but stress is a very big one. It can cause problems with growth hormone, and that's why you may have been hearing about growth hormone. But autism affects a lot of our hormones, whether it be melatonin coming from the pineal gland or the thyroid. Autism affects a lot of our hormone system. Okay, let's move on here. Protein deficiency. A lot of our kids, like my son, would not eat anything to do with protein, and you have to be careful with that. So I use rice protein powder to start. You could use targeted amino acids, but I try and see if I can't get that digestive system to work. and rice protein powder with a good digestive enzyme. The doses are in your book there. Many of our children do lack the digestive enzymes needed for breaking down foods. I use a digestive enzyme called pancreacarb. That's a prescription, so it saves parents a lot of money. They pay their $5 or $10 copay and they get a $100 bottle of digestive enzyme. But there's some very good ones out there, like from Kirkman's lab. I started using Creon way back when, because that was what was used in cystic fibrosis, and I was very familiar with it, diarrhea for my son. Probiotics, we already covered that pretty well. I, again, tend to use the one that works for the particular child. If one is not increasing your child's lactobacillus colonies, but it's the best, it's such and such brand, that's okay, switch over to a different one and see if that strain, they're not all the same. These are different strains, and everybody, if you listen out there, everybody's got the best strain, okay? Just be careful with that and just move over. Allergies, our children have lots of allergies. I'm going to use this time of my talk just to talk about symptomatic relief. Absolutely going after the cause of the allergy is beyond the scope of our lecture here, and why they're having so many problems with timothy grass and house dust mites and molds and foods. Claritin Ready tabs have worked very well for our children. They have the least amount of stuff in them, no dyes and lactose and all, and they melt in the drink or right on their tongue. Zyrtec is another good one that your doctor can write for. Singulair, Nasonex, Reflux, Benadryl, removing certain foods. And if you have to go see an allergist, provocation, neutralization, desensitization is a very good form of allergy control in the children, because they can get either sublingual drops to control their allergies or nasal spray. There's very important sleep issues. How many of you out there have children who have sleep issues? Whoa, I'm so thrilled that you're all still awake. It's terrible. I do not do well with 20 minutes sleep and I'm up in 20 minutes. See, unfortunately at my house I'm the doctor, so if the kid's crying, go get them. Find out what's wrong. So I'm also the designated barf picker upper too at the house. It's tough. But anyway, here's what I've found that's simple, that works for our kids. Melatonin, 0.5 milligrams to 3 milligrams at night. Magnesium. Fixing the gut, obviously, the gluten-free, dairy-free diet. I can't tell you how many kids start sleeping once they go GFCF. I mean, I don't even have to get to this stuff. 5-hydroxytryptophan, tryptophan, making serotonin, making melatonin. It works wonderfully for our kids. Using herbs, milk thistle, valerian, chamomile tea, and then sometimes, darn, if I don't have to get into my MD tool chest and I have to get the child to sleep. For his sake, for his sanity, for his ability to resync up with his day-night activities, but also for the parents, because it's very, very tough on the parents. But that's just short term. If I have to use something like trazodone or Risperdal, it's just to buy me more time to figure out what on earth is going on in this kid's body that's not allowing him to sleep. Oxidation, you're going to hear a lot about. I just wanted to put this in here. The vitamins A, C, and E, again, all together work as opposed to one individually. Our kids tend to run in a very oxidized state. Methylation, I just put a couple of slides in for methylation because you're going to be seeing a lot this weekend on this. Bottom line is our kids need glutathione. Our kids need glutathione, whether it be IV or transdermal. I borrowed from our cystic fibrosis literature about using inhaled glutathione. I actually put it into what's called a nebulizer. Maybe you've seen these asthmatics with the breathing machines. I'll actually do nebulized. Brain glutathione in patients with epilepsy measured by in vivo 1-HMRS. Bottom line of this study, because I have so many kids who have seizure disorders, that Lamictal and all the anti-seizure medicines don't work. Bottom line, you can read there in yellow. The authors found evidence for widespread impairment of the glutathione system in patients with epilepsy independent from seizure activity. So again, by giving them glutathione, by giving them the precursors that help their body make glutathione, their seizures improve. So what do I use for methylation support in the clinic? SubQ methyl B12, transdermal N-acetylcysteine, transdermal IV or inhaled glutathione, TMG, DMG, folinic acid. And again, you're going to get plenty of that this weekend. Jill James has shown that looking at baseline autistics, when we do these things, we can increase their glutathione levels. It's been proven. So bottom line, my recipe for success, lots of prayer, lots of love, sound biomedical advice, and lots of therapy. because what we're doing is we're going to enable those therapists to get more out of the time they have our children, if they're healthy, if they're well, if they're receptive, if they're happy, if they just feel great with what I call the skin that they're in. So lessons that I've learned: enjoy each day, don't wait till they're better. Expect some ups and downs along the way. You're going to do some really wonderful things, but you're going to have some really hair-pulling adventures, especially when they get a cold or an ear infection. Make sure that you have fun with all the family members, and there you can see a picture of two other of my boys, my wife in the back. Oh no, I'm not supposed to say that. The efforts you make today, I know this is hard, and what you're going to hear about between all the supplements and the diet changes, and it will pay off, because these kids as teenagers can be very difficult if you don't get them now. And for those folks who have older kids, it all helps. You know, they say, if you don't get this done by the time your child is 7, you're not going to. That's not true. It's not true. We get a lot of good results with our teens. And that's all I have for you. I do have one more thing to add, though. At the Thoughtful House, I want you to visit our booth. If you happen to have a child who has autism and subsequent younger children that do not have autism, but you did not give them the MMR, okay, so the younger siblings who have not received MMR, we need to talk to you about that, okay? Because we have some interesting findings about siblings who have not had the MMR when the older autistic child does have MMR. So come by and see us if you happen to have that. That's my pitch for Thoughtful House. Thank you very much.